Welcome, I'm Dr. Atkins from the Cosmetic Enhancement Center. Thank you for coming to our virtual event on Softwave, our newest tightening device for skin tightening and lifting. We want to show you a demonstration of the device, and during that there will be some questions that you can ask in the chat box below. Please feel free to ask your questions. It is anonymous. No one will know what you're asking. Don't be embarrassed. As a thank you for coming to the event, we will be entering you into a raffle for a free giveaway, and you will be getting access to special pricing as well. Softwave is the newest ultrasound device that does skin tightening and lifting. It has been FDA approved for 7 indications, lifting and tightening, laxity, acne scars. It's the only device on the market that delivers 4 seconds of energy to get the skin to a temperature of 67 degrees without any downtime, which is spectacular. There are other devices that can get to that energy, but not with the no downtime in and out procedure that can be done even in the summertime. So Softwave can treat fine lines and wrinkles, skin laxity, eyebrow lifting, neck and submental lifting, that's the under chin, as well as acne scars and cellulite. It is approved for arm laxity as well, but can be treated anywhere on the body where there is some laxity. There is no downtime with Softwave. Very rarely you might have a small spot of redness for a day, but most people walk away with no one noting that they've had anything done. You might feel a little bit of warmth in the skin for a day, but again, it wouldn't be visible on the surface. So it's one of those treatments that you can do on the fly in the middle of summer and not really have anyone know you had anything done. With maximum results, you'll see some improvements in even within the first month after the treatment, but you're going to see most of your result in 3 to 4 months after the treatment. So most of you know me and know that I will partake in all the treatments that I bring on here because I believe in them. And in a few minutes, we'll go upstairs. You'll be able to see Rita treat me with the Softwave and show you the consultation piece of what will happen prior to your treatment. Hi, so here we are. As promised, we're going to demonstrate a Softwave treatment and a consultation and what you'll expect and see during your treatment.
Hi everyone, I'm Rita, one of the estheticians here. I'll be walking Dr. Atkins through our Softwave treatment today. So I just want to ask you, what areas are you concerned about today? What brought you in?
I think my biggest concern is always under my chin. It's like the most lax area.
Okay, do you mind if I just take a feel? Yeah, just a little bit. I think this would be an excellent treatment for you. So you're all numb, which is excellent. Patients can either numb at home or right here in the office. All right, so what we'll do is just clean the area. I'm going to put on a little bit of ultrasound gel. That will just act as a nice slipping agent during the treatment. And then we'll get going. Do you have any questions for me?
No.
Excellent. Great. Okay, so this is the Softwave handpiece. This is what will be making contact with her skin. It is a little bit cold to the touch, helps cool the skin during the treatment. Dr. Atkins, what you can expect is a couple seconds of warmth, 1 second of hot, and then it will cool right back down after. If you are getting uncomfortable though, we have ways to relieve that. We have a chiller that will just cool down the area and distract you. We also have some hand pieces that vibrate a little bit. That's a good tool that we use sometimes. And we have Pronox, which is a form of laughing gas. So just let us know if you get uncomfortable. All right, we're gonna get started.
Thank you all for coming to our event today. We hope you've gotten a better idea about how Softwave can help you reach your specific goals.
I know we covered a lot of information, so hang tight. Dr. Atkins is going to jump on for a question and answer session to answer any other questions that you may have about our Softwave treatment.
Keep an eye on your inboxes because we will also be notifying you if you are our lucky draw for a free gift from CEC.
If you're ready for Softwave to start working for you, simply reply to the text that you will be receiving right after the question and answer session, and we will reach out to book your appointment.
Thanks for coming.
Hi, everybody. Thank you for coming again to our virtual event. I'm here to answer some questions, and it looks like there are already a bunch of questions. So I'm going to get started. Someone has asked, I've done Ultherapy. Can I do Softwave? And yes, absolutely. Ultherapy is an ultrasound device as well, which was our original ultrasound device here. We are very well versed in our Ultherapy treatments too. But Softwave we brought on here, or I brought on to the Cosmetic Enhancement Center, because the energy delivered is so much greater that you're actually not just stimulating collagen and getting some tightening, but you're also stimulating elastin, which doesn't happen until you've gotten 3 or 4 seconds of heat in the skin. And that's what Softwave does. So absolutely, you can do Softwave if you have done Ultherapy in the past. Even if it's been recent, I'd recommend, waiting a few months after Ultherapy, but you can absolutely do a Softwave treatment in conjunction or after Ultherapy treatment. The Softwave pulses are less painful typically than Ultherapy. Get those zinger nerve pains that you can get with Ultherapy, and yet the energy delivered with each pulse is about 7 times one Ultherapy pulse. I have here a question. I have filler in my face. Can I still do this? Absolutely. We always recommend with any filler or Botox that you're going to want to wait at least 1 month after those treatments to do a Softwave or any heated device, really. You don't want to heat up the skin and affect the filler and the Botox for at least a month after. If you're doing Softwave on the same day as filler or Botox, you just need to do the filler or Botox after the Softwave treatment. Could I use this on the skin above the knees? Absolutely, you can. It can be done on all body parts. It's definitely useful. Any lax areas, we treat a small area at a time. We can get some improvement in the wrinkling in the knees and get some lifting in that thigh area. You do need to do 2 treatments when it's a body part versus the 1 treatment we recommend for face and neck. There's a question about, do you have to stop any other treatments prior to Softwave, such as retinol? We definitely like to have people stop Retin-A or tretinoin for a day or 2 prior, but it's really not that concerning because we're going below the surface of the skin. You just might be a little more comfortable with the gel on the surface of the skin if you don't have any irritation there. If you've been very comfortable with your retinol, haven't had any irritations on the surface, and you don't ever see any redness there, then you can probably do it without even stopping. Is it okay to use if you've had Sculptra? Absolutely. In fact, I've done it immediately after having a Sculptra treatment, and that helps too because then you're already numb after the Sculptra. So Sculptra can be done in conjunction with Softwave. And remember that Sculptra is an injectable that stimulates collagen as well. So when you're really hollow in the preauricular area or the temples, we can treat that area, and then you can go on and have your Softwave the same day. What's the pain like versus ultherapy? Discomfort with Softwave, as I had said, is usually less. There's usually a little heat feeling. First, the tip is very cold to touch, like Rita said on the video, and then it starts to deliver the energy. And once it gets to that fourth second of energy, you feel a little hot, and then it goes right to cold again. So you can kind of anticipate when it's going to be hot, and then it comes right down to the cold temperature again. So it's really not too bad, and we can adjust the settings so that people are pretty comfortable during that treatment. Do you normally need more than one treatment? No, typically, unless it's a body part, you generally only need one. Have I had people want to do more than one treatment? Yes. You have to remember these things are non-invasive skin tightening procedures. They're going to improve the area. You will see some improvement, but I've seen people who have improved and been so excited by it, they wanted more improvement. So that can happen, and some people may want to do a second treatment, but it isn't necessary. You will see a great improvement even in just one treatment. We have recommendations of waiting at least 3 or 4 months after a treatment, because you're going to continue to see that improvement before you even consider a second treatment. But honestly, with any tightening device, your maximum result is probably going to be like 9 to 12 months later anyway. So usually any tightening device, you're going to want to repeat once every couple years, or maybe do a touch-up treatment once a year to kind of keep up with that aging process. How long does it take to get an appointment? So usually you can get in within about a week with our Softwave treatments. It really kind of depends on the day. If that device is the Softwave is booked up, then we'll have to move on to another day. But we have multiple providers that can do the Softwave, and it's just a matter of whether or not the Softwave is available. Typically, usually within a week, you can get in. How long does it take to see your results? So typically, I've seen people after the treatment with this Daxify special we've been having, and I'll be seeing them for the Daxify afterwards, and they literally sit up off the table and say, I think I see an improvement already. And I can't tell you how many times that has happened to me, that people feel and look smoother and tighter immediately. Does that mean that everyone will? No, of course not. But consistently, people are seeing improvements about a month out, and definitely by the 3 to 4 months, you should see some visible changes on photos. Procedures, does this replace or is better than you currently offer? Okay, so this is not going to replace any of the lasers that do pigment and redness and the kind of dyschromia that happens on the surface of the skin. This bypasses the surface completely. That's why it can be done in the summertime. Even if you're tan, we don't want you to be tan, but even if you're tan, you can do the Softwave in the summer, because it's focusing that ultrasound energy underneath the skin at 1.5 millimeters. So you really aren't affecting that surface. So it is going to be purely for tightening. There are some lasers that we do, like CO2 resurfacing, that does tightening a little bit on the surface and smoothing of wrinkles and pigment and redness, but it's not necessarily going to get as deep as the Softwave can. How long has the technology been around and tested? So the device we just recently got it back in April. The actual device has been over a year, but this technology, the one of the creators of the technology is actually one of the creators of the Profound device. We have the Profound as well. The Profound is a microneedling device that actually has not so microneedles that go deep into the skin and deliver that 67 degrees Celsius of energy for 3 to 4 seconds. And that person who helped to create that Profound was also part of the creation of the Softwave. And that's why he knew he needed to get that amount of energy in the skin for that amount of seconds. So this technology trying to deliver that amount of energy was was what they were going after with something that would cause less downtime. So it's been researched for a long time and in development for a long time. What did you use besides the numbing? Did you find it painful? So I don't generally, for any of the procedures I do, use Pronox. It's very common. Most of our patients do use it. It's a laughing gas. I just like to kind of know what to tell people and not have my head clouded by that. I usually don't do that, and I didn't with the Softwave. I have had the under chin treated. I've had the full upper face treated as well. I haven't had the mid face treated yet, but so far I've tolerated it without any Pronox. I did use the chiller, which is a hand piece that blows cold air on your skin, and that kind of helps to cool the skin down as well as distract you a little bit. And that definitely is, I found, useful. And then of course the numbing cream that we used prior to for about 45 minutes. And did I find it painful? Yes, it hurt, but it wasn't as bad as some of things like the old therapy I've had in the past. I felt it was very tolerable. Someone's asking about cost. So cost depends upon the area. For instance, if you're doing the full face treatment, it's around $3,000. If you're doing the full face and neck area, then you're looking more like $4,600. If you're just doing the lower face and neck, it's $3,200. If you're going to do the neck only, it's $1,700. One body part treatment is around $1,400. So it's definitely a hefty price, but you only need one treatment to see a result, except for the body areas. What does it feel like on your skin? Cold at first, and then heating, hot, and then cold again. How long do the results last? Typically, any tightening procedure, I recommend a touch-up treatment once a year, but most of the tightening procedures are, they're not surgery. You're going to have to repeat them at least once every 2 years. How do results compare to a facelift or a mini facelift? There is no comparison. Surgery is surgery. You're removing tissue, and we're not doing that. So this is for the people who don't want surgery. You're not interested in surgery, then this is what you should do. If you think you might be interested in surgery, you will 100% of the time get more tightening and more lifting from surgery. Okay, I have someone who said, I just had my lower face done this week, did have the lidocaine on top of the area, the topical lidocaine, was not that painful, went to work afterwards. So there's a personal experience right there. No issues with hyperpigmentation. No, this is going down below the surface of the skin. There should be no hyperpigmentation issues. How long does the process take if you do the lower face and neck? So typically, the lower face and neck would be about an hour and a half treatment, maybe an hour and 40 minutes. But that's only the treatment time. Again, remember, each pulse is about 4 seconds long, and then we do multiple pulses throughout the area. The numbing part of it is beforehand. So we get you in, we take pictures, and then we'll do the numbing for about 45 minutes before you actually have the treatment done. If you've had RF microneedling, how long should you wait? Can you use Pronox with it if you want the higher setting? You can definitely use Pronox with it anytime you want. The RF microneedling, you'll probably need to wait at least a month, but again, with RF microneedling, you're going to get some result for at least 3 or 4 months afterwards. So you may want to see what your result is of that before you do a Softwave treatment, and that would be a 3 or 4 month mark. I'm scheduled for Mohs surgery. What do you recommend for wait time? So I think that with Mohs surgery, you're going to, and for people who don't know what that is, anytime someone has a surgical procedure, you're going to wait afterwards in order to do treatment with Softwave, but Mohs surgery is basically for skin cancers. And you want to make sure that skin is completely healed. So I'm typically recommending at least 3 to 6 months before you do a Softwave over the surface of that area. What is the difference between this procedure and RF microneedling? So with RF microneedling, you're using radio frequency energy, and you're delivering that energy through needles into the surface of the skin. With Softwave, there are no needles. You're not actually breaking the skin at all. And that's why there's no downtime. And you're also using ultrasound energy. It's synchronous ultrasound parallel beam energy delivered. It's patented technology that is delivered using an ultrasound handpiece. So it's not radio frequency. There's no issue with people who have pacemakers and that kind of thing. With a radio frequency, you have to be careful about people who have metal and pacemakers. And with ultrasound energy, you don't have to worry about that. Will this improve the look of smokers' lines? Absolutely. And not only that, you can probably get some lifting in the lip. It's not FDA cleared for that. There are 7 different FDA clearances on this, but I've seen improvement in lip lines too. The 7 FDA clearances are facial lines and wrinkles, lifting of the eyebrow, lifting of the neck tissue, laxity of the submental tissue, improvement of cellulite, improvement of acne scars, and improvement of arm laxity. So there's a lot of FDA clearances, and they're continuing to come out with them. Minimize the amount of filler and Botox you may use moving forward. So someone asked if this will minimize how much Botox and filler you might use. It's very possible. If you saw some of those before and afters go through, it looked like some of those people had filler, and there was no filler in those photos. It was purely Softwave. And the only reason that is happening is because of the amount of time on tissue. You're using that energy for a full 4 seconds and getting that tissue temperature up to that 67 degrees, which is causing stimulation of elastin. It's nice to stimulate collagen. Even fillers will do that. A lot of devices do that, but not very many stimulate elastin. And that actually creates volume in the skin. And so you may have less need for volume. Now, if you're completely depleted and you really need a lot of volume, then you're going to probably need both, but it can minimize how much you need of some fillers. Will it lessen your need for toxins like Botox? That's a hard one. It depends how far your skin has gone with the quality, but the whole idea behind this is you're improving the quality of the skin, and potentially if you improve the quality of your skin, when you crease the skin by smiling or frowning, you're going to have less resistance and caving in of that skin. Just like when a child smiles, they don't get the lines down their cheeks because their skin quality is so good. We're improving the skin quality, and that's the goal. And hopefully that means maybe a little bit less toxin in the future too, but that's not likely going to happen for everybody. Is this the procedure the most effective other than surgery for tightening of the neck? Yes, I do believe so, because of the amount of energy delivered. Can I numb at home for this treatment? Absolutely. We have no problem with you numbing at home. We provide the numbing cream in the office, and you can even have it mailed to you if you want. So if you have a long drive, you can apply it before you get here and drive in with it on. Is it one per year or once forever? No, nothing is forever. You have to remember that you're continuing to age every year. I'm recommending a touch-up every year, or repeat it a full treatment every 2 years. It's the same recommendation I gave for people who do Virtue. Instead of a package of 3 treatments, you might do 1 treatment a year. Otherwise, you're going to end up having to do a whole series again in 2 years. Same thing with old therapy. I always recommended a partial treatment once a year just to maintain it, but you're going to need to repeat it completely if you've gone 2 years without it. Side effects. There's really no side effects. You can get a little bit of a patch of redness in one spot or another, but it's rare. I have seen it twice, and only in one spot on 2 people. It's basically, typically you look like you have had nothing done, except you might look like you have a little glow on because you had all that ultrasound gel on your skin, hydrating your skin for an hour and a half. But no, no one would know you had anything done typically. How many pulses are in a typical lower face treatment? I have TMJ. Do I have any idea if this will affect or cause any residual pain? It's not going to affect TMJ. This is not going down to muscle, so it shouldn't be an issue with that. With regard to the number of pulses, A lower face can range. We're typically doing around 300 pulses for a lower face. Depends on the face. You know, some people have larger faces or smaller faces. We're not going to do, say, 300 pulses on somebody who's very, very petite. But we try to get in at least 3 passes. Sometimes we'll do 4 if there's a lot of laxity in order to get enough of a treatment in. Could you just target one small area on the face? Yes, you can. So I've had people just do the perioral area, which is full perioral is $705. If you're going to do just say the crow's feet and under eyes, then it's $675. You can focus on one small area and see how you do, but those people have typically come back and done another area because they're seeing the results so fast. Will it improve pore size, particularly on the nose? We don't actually treat the nose. It's hard to get the good contact on the nose. So I would say in other areas, yes, because when you stimulate collagen and tighten the skin, you will get improvement in pore size. And I have seen that on some before and after photos on my own patients, but we don't actually treat the nose area. We'll treat close up under the eye here, but not actually on the nose. It's hard to get good contact across the nose. Okay, it looks like we've gotten to upper lip cost. So I gave you the full mouth area cost of $705. If you're just doing half of that area, it would be half that price. That's it.